Good afternoon, everybody, and welcome to this special symposium event hosted by the Center for Practice Excellence at the University of Toronto. My name is Zubin Austin, and it is my pleasure to welcome you to this interesting and important event in the evolution of the profession of pharmacy, focused on environmental sustainability and climate change. I will turn it over to my colleague, Annalise Mathers, the administrator for the Center for Practice Excellence, to introduce our speakers and our agenda for today. Annalise.
Thank you so much, Zubin, and hello to everyone who's just joining us online. As Zubin mentioned, we are very excited to welcome you to our CPE sort of special symposium event on environmental sustainability. This is our last event of 2022, and so we're really excited to be able to share some really important perspectives from each of our panelists today, and then also just hope to really set the stage and gain momentum on this important topic and as we move forward in each of our practices. So just to start off our event today, I'd just like to start with an acknowledgement of the land that I'm on. Today, I'm not at the University of Toronto, it's where I work, but I am based in Toronto right now. And for thousands of years, it's been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous peoples from across Turtle Island, and we're very grateful to have the opportunity to work on this land. For my own personal path to truth and reconciliation, I personally have reflected on my experiences benefiting as a settler from living on this land here in Treaty 13 in Toronto, as well as throughout my education and training on the land in Ottawa and in British Columbia. I'm really grateful to work towards a deeper understanding of the history that's brought myself and all of us today to reside on this land and to work towards creating environments of mutual respect and learning. So I think that's very fitting for our event today as well. So as you'll have seen in sort of our promotional material, this CPE session will bring together very unique perspectives on the pharmacy sector's impact on climate change, the ecological emergency the world is facing right now, and the practical solutions community pharmacists can take, not only to protect our environment through green pharmacy practices, but also to be able to respond to a lot of the health and patient needs that are emerging from the climate crisis. So just a quick overview of kind of how the day is going to unfold. We will begin with some opening remarks from each of our panelists, who I'll introduce in a minute. And then that will be followed by a short panel question and answer, and we'll save the remaining 20-25 minutes or so for audience question and answer from everyone online today. For a few logistical considerations, just as we get started, I'll just ask that you keep yourself muted and please put any questions or comments for any of our panelists in the chat, and we'll get to all of those questions and comments at the end of our event today. So just getting started, I'd like to do a brief overview of our panelists, and then I'll hand it over to Fiona, who's going to be providing some of the first initial remarks. So Fiona is a professor of health policy in the Institute of Health Policy Management and Evaluation in the Dalla Lana School of Public Health here at the University of Toronto. She holds the chair in health management strategies, is a Conant Scholar, and is the founding director of the Center for Sustainable Health Systems. In this role, Fiona leads and supports efforts to improve the environmental and social sustainability of health systems through research, practice, change, and policy advocacy. We had the pleasure of hosting an event last year as well with Fiona, and we're really looking to building on that in today's event. Shaliza is the current chair of the Ottawa Hospital Pharmacy Environmental Stewardship Committee and identifies as an oncology pharmacist working within both climate change and global health settings. Shaliza completed her Master of Pharmacy at Aston University and later completed a PharmD at the University of Toronto. Along with working on the Climate Pharmacy Committee at the Ottawa Hospital, Shaliza is currently working with colleagues across the country to build a climate pharmacy network. Celia Cully is a clinical pharmacist and pharmacy clinical coordinator at the Royal Jubilee Hospital at Island Health in Victoria, BC. She's been an invited guest speaker and panelist on the health impacts of climate change, adapting healthcare to our changing climate, and her work on climate-conscious inpatient inhaler use. Her goals include empowering healthcare professionals to advocate for positive change in the healthcare sector. Terry Drover is the Director General at Health Products Stewardship Association, or HPSA, which is a Canadian nonprofit that runs take-back programs for unwanted medication and used sharps. Before joining HPSA, Terry accumulated over 30 years of executive experience in the pharmaceutical industry, holding various decision-making roles for pharmaceutical companies in North America. At HPSA, Terry leads the strategic direction of the team to fulfill their mission of protecting the health and safety of Canadians and the environment from the improper disposal of unwanted medications and used sharps. She's passionate about bridging the gap between healthcare and the environment. And finally, Tariq Hussain. Tariq is a frontline primary care, community, clinical, and compounding pharmacist, Lean Six Sigma Green Belt, and a healthcare management consultant who provides comprehensive pharmacy services, including specialty compounding, medication therapy and disease state management, immunization, point of care and pharmacogenetic testing, deprescribing and prescribing for smoking cessation and minor ailments. As the founder, owner, and manager of Weller Pharmacy since 2012, Tariq has provided leadership and guidance to all staff to ensure an excellent customer experience, which has led to his pharmacy being recognized as the best pharmacy in the city of Kingston in 2019. And his leadership was also identified through a prominent award by Sustainable Kingston. He is pursuing his Doctor of Pharmacy degree at the University of Toronto's Leslie Downe Faculty of Pharmacy with a special focus on global health. So needless to say, our panelists are going to bring such incredible and important perspectives to our event today. Without further ado, Fiona, I'd like to pass it over to you to get us started.
Thanks so much, Annalise. I really appreciate this opportunity to chat with you all. I get opportunities to talk with groups of health professionals, and always very exciting to engage with pharmacists. So as Annalise says, I do work locally. I also do work nationally. I lead an initiative called Cascades, which is funded by Environment and Climate Change Canada for climate action and awareness in healthcare. That is a partnership between my center at U of T, the Healthy Populations Institute at Dalhousie, the Planetary Healthcare Lab at the University of British Columbia, and a national NGO that's been in this business for over 20 years, which is the Canadian Coalition for Green Healthcare. And that, as both a researcher and as somebody who's very engaged in supporting practice change and policy development, I approach this talk today. So I typically start by just posing it as a question, because I think for many folks, it starts with a question: is climate change our responsibility? Is it our business? And I'm obviously going to answer yes, and point a little bit to the specific ways in which that's true for pharmacy, but leave it to my colleagues who are specialists in pharmacy and pharmaceuticals to really elaborate those points. I'm not going to spend much time talking about climate change. I think we all know that it's happening. We know that it's human caused because the climate variability that is natural, we're well past and well beyond that kind of climate variability. We're at 1.1 degree global mean temperature increase, and the projected increase by 2040, or potentially quite a bit before, is 1.5. That's the point estimate, but the range is 1.2 to 1.9. So we are definitely on track for significant global heating, and much of that we're locked into now, although significant changes can be made in the trajectory beyond that on the basis of what we do today. And we're already seeing the effects. These are images from British Columbia from the summer and fall of 2021. And they're pointing both to the heat issues, that extraordinary heat dome, the concentration of heat within the lower mainland and into the inland areas, the wildfires. We've seen more wildfires this past summer. The atmospheric river in the fall, sort of concentrated, sort of holding pattern of a severe weather system leading to significant infrastructure damage. And these are the kinds of extreme weather events that we expect to see more of. We expect them to be more of them. We expect them to be more extreme. We expect them to last longer, and they are having an impact. And so the first reason why health systems, whether we want to or not, are going to have to pay attention to climate change and make it our business is because it is being forced on us. We are going to have to adapt and build resilience to the shifts, the stresses, and the shocks. So when we think about those images of really acute shocks, it's not surprising when you think about the demand of a heat emergency that would occur in the lower mainland. So an absolute spike in heat-related illnesses. And at the same time, you think about that atmospheric river and the significantly reduced capacity. How do you get medications to patients, particularly in rural or remote areas? How do you get folks to their dialysis? But it's, of course, not just the acuity. It's not just those extreme events. It is the chronic and compounding nature. You don't need to have a heat dome to have chronic impacts on health from increased heat. Heat that will profoundly affect certain populations, so elderly populations, younger populations, pregnant women, but also be patterned within, say, urban environments, so that certain parts of the urban environment that have less green cover, that have less access to parks, that have more sort of vertical communities with limited or poor quality air conditioning and cooling capacity, create these chronic stresses within communities that are very inequitably distributed, and at the same time are challenging our operations. So our supply chains, facilities, workforce, service arrangements, and as I'll flag in more detail, our clinical practice are affected. So here's a specific pharmacy issue that I know my colleagues would dig into more deeply from Health Canada about the fact that certain quite common medications are affecting the body's capacity to manage heat, conferring extreme added risks, which can be compounded by other social and health-related factors. So that's the first answer to the question as to why health systems must be engaged. We will have to adapt. We will have to build resilience. The second answer relates to this kind of bizarre flip side, which is the extraordinary extent to which healthcare is part of the problem as a very, very resource intensive and highly polluting service industry. So this is an image from the Lancet Countdown on Health and Climate Change and their latest estimate of how much the healthcare industry, how much carbon or how much greenhouse gas is coming out of the healthcare industry. And their estimate is that 5.2% of global emissions come from healthcare. This image then is an attempt to map out the carbon intensity across the x-axis on the bottom there. So on the x-axis, the farther out to the right that you go, the more carbon intensive your health system is. And on the y-axis, it's an indication of healthy life expectancy. So sort of health achievement. The farther up you go, the greater the health achievement. So there's Canada, reasonably good health achievement, but at significant carbon intensity, right? We're quite far out on the x-axis. So there are countries that are achieving more health with less carbon intensity, sometimes with considerably less carbon intensity. And you'll also notice countries like India or Indonesia, Brazil or Mexico that clearly need access to more health supporting interventions, including healthcare. And so generally, healthcare is a global good that is in insufficient supply in many, many parts of the world. So we need to think about growing access to high quality healthcare without increasing our global footprint, which is already quite significant. And I won't dwell on this, but I will point out that despite, I think, our initial expectations, including my own, when I started to work in this area, the bulk of the climate impact of healthcare is not in our buildings. It's not just because we run 24/7 big facilities like hospitals. It is in fact embedded in our care. It's embedded in our products and services, and pharmaceuticals are a particularly significant hotspot, as about 25% of healthcare's climate footprint. That's an English estimate as well as a Canadian estimate on the basis of studies done of health system greenhouse gas emissions. So there is quite a bit of attention to the role of medicines and pharmacists in building a lower carbon, more sustainable health system. And I'm just calling attention here to work from the UK, and in particular, a really lovely report on overprescribing from a year ago now, and related work from their National Health Technology Assessment body, NICE, on the potential to reduce greenhouse gas emissions through medicines optimization. So all the kinds of things that I know are part of your regular practice as pharmacists, to think about reducing overuse, to support alternatives to medicine where they are appropriate, things like social prescribing, reducing the environmental burden of the medicines that we do need to use through low carbon procurement. That's a big push within the UK or within England, low carbon options when they're available, and obviously all of the issues of stewardship and waste management that I think are what this profession plays such a critical role in managing. So, and all of this, I think, comes back to many of the core principles of what we're trying to do in healthcare. Many of the reform agendas for healthcare, being more patient-centered or more person-centered, more integrated, more coordinated, are really a very, very big chunk of what we need to do to make our health systems more sustainable, lower carbon. And just flagging, again, an image from the UK work about how much this is central, I think, to pharmacy practice, patient-centered approaches to medicines optimization. So if that's the sort of context, if the answer to should health systems engage in climate action and awareness, if the answer is yes, what is the context in which we are doing this work? And I will say that it is, although a very, very challenging context in terms of climate change, it's an increasingly supportive context for the work that we're all trying to do. And I, and most people like me, will point first to England and the National Health Service in England as really a global leader in driving change. And they've been working on this very actively now for 14 years. So they've had ever since the UK brought to bear a climate change act, sort of as legislation for the country as a whole, there has been a sustainable development unit attached to the National Health Service that's been working steadily on this agenda for change, and has been significantly enhanced in size and in role with legislative support most recently through the Greener NHS program. And that's led them, in the depths of the pandemic, October 2020, to commit to being the world's first net zero national health service with 2 dates. The image to the right there gives you a sense of those dates. The 2040 date is for that white triangle, and the 2045 is everything else. And a lot of what is everything else is medicines, and a lot of how they're going to drive change there is procurement. But certainly there is, within the first 2040 date, lots of relevant appropriate care issues, like and some low carbon options related, for example, to respiratory care. Though the US is by no means a leader, I think it's important for us in the Canadian context that our colleagues to the south are engaged, and they are. And they have been now for about 1.5 years in terms of national commitments. There's obviously been an enormous amount of work done by some leading health systems in the US. But in terms of a national commitment, we're seeing that both through a public-private partnership, actually, under the auspices of the National Academy of Medicine, to build capacity, to build toolkits, resources, to bring together experts around the decarbonization agenda. And then within the Federal Department of Health and Human Services, there is a small, but still an office under the auspices of the Office of the Assistant Secretary of Health, is an Office of Climate Change and Health Equity. And they are looking very seriously across the health portfolio for the federal government in the US, which includes the NIH, and there will be and is research needs here, and they will be supporting that, as well as the US FDA, very important for those of us interested in medicines, and other ways in which they may be able to drive change. To this point, what they've done under the office, in addition to driving change in the federally owned portions of the US health system, so Veterans Affairs and the Indian Health Service, where there can be a sort of requirement of decarbonization. The rest of it's been through a call for voluntary commitments across the private health or the privately run and sort of partially privately financed health systems. And that's been important for what we've seen globally. So many of you will be aware, we've just finished COP27 in Egypt, COP15 for biodiversity, a related issue that's happening in Montreal. But it's been at the climate change conferences that we have seen a steady elevation of the issues of health. And in the last year's Conference of Party, UN Climate Change Conferences that was held in Glasgow, so under the leadership of the UK, there was a formal health program for the first time, and a call for countries to commit to deliver climate resilient and low carbon sustainable health systems, and very much prompted by the Americans who signed up before Canada. Canada did in fact sign up. And it's a very, very important commitment. We're already starting to see movement from the feds that's going to make this a more supportive environment for those of us trying to do this work. But it really was the first time, November 2021, the first time that the federal government acknowledged that the healthcare sector needed to be part of the transition to a net zero economy. They have long understood the need for health system resilience. In fact, within Health Canada, we have some of the world leading experts on health adaptation and health system resilience. But about a year ago, it was the first time they recognized that healthcare needs to be part of the decarbonization agenda. So I think that's extremely important. And we're seeing it, as I say, in an array of federal initiatives, much of it connected to the National Adaptation Strategy. And also, though, in Climate Science 2050, we've seen some emphasis on this within the recent report from Canada's Chief Public Health Officer, Theresa Tam, on mobilizing public health action on climate change. So really elevating that as an issue. So I think this is a very supportive and increasingly supportive context for the work that we're going to do as researchers, as clinicians, as analysts, as leaders, as managers. But a lot of the action will have to be at the provincial level. I'm happy to chat more about that as a health policy professor. But we are a very decentralized federation, and much of the leadership needs to come from the provinces, and it's quite variable. British Columbia is hands down the leader on this, has had a Climate Change Act since 2008, like the UK. Since then, health authorities have been paying a sort of carbon offset. So it's been part of their thinking. It's been part of their building strategies. What I'm showing you here is part of a mandate letter. So what's important and in these kinds of efforts is that oftentimes the health sector is being driven to make change related to climate, not by ministries of health. It's often being driven to make change by ministries of the environment or energy or infrastructure. And that's very helpful, but it's very important that ultimately we get policy support from ministries of health. And so this is a mandate letter from the Ministry of Health to the health authorities. And since 2019, the Ministry of Health has asked the health authorities to make climate change one of their priorities. And I think that's very important. And that means that we're seeing tremendous top-down support for incredible bottom-up leadership across British Columbia. I would say that Quebec would be the next province that's really leading the way, and in terms of very intentional engagement by the Ministry of Health in this work. Quebec has always framed these issues as issues of sustainable development across a range of agendas for transformation. And every integrated health and social service sector must have a sustainable development committee, and they're increasingly engaged in supporting quite innovative work across the réseau. But even where there isn't a really clear set of guidance and direction from ministries, including ministries of health or other government departments and ministries, we're seeing in places like Alberta, which does have legislative imperative pushing the health service, but this is guidance, or this is policy from within Alberta Health Services. Again, in the depths of the pandemic in August 2020, they committed to really elevate an environmental sustainability team within the health service and to take on some really ambitious agendas for change. So there is real movement happening. But again, a lot of the leadership continues to occur from the bottom up. And I would argue that we need both, that we cannot get top-down direction without bottom-up leadership. And this is a very, very biased set of images because these are all the folks that I work with very, very closely across the country and locally. But just to say that I think that's what we're engaged in, is really innovating locally and figuring out how these things need to be done, and then spreading them, scaling them, sharing them, so that we can make more transformative change. So I'll close here just to say that I think it's really without question that climate change and other global ecological, and they are compounding socio-ecological challenges. They implicate health services and health systems, and we will need to adapt, and we will need to make change. And momentum is building. It's always, I think, both both the worst of times and the best of times. But I think that there's real opportunity for us to collectively do much more together. And with that, I will pass it back to Annalise and my colleagues.
Thank you so much, Fiona. You've done a wonderful job of just sort of painting the landscape both globally, but also starting to touch on some of the work going on provincially here in Canada and locally with some chapters that you've highlighted in your slides. So I think that perfectly sets the stage for some of our other panelist remarks. Just to get us started on that, I'd like to hand it over to Shaliza, who will be walking us through a little bit of who she is and what she does.
Perfect. Thank you so much. I will share my screen. Here we go. All right. Can you see my screen?
Yeah, if you just you can put it into presenter mode and you should be all set.
Perfect. Okay, so I'm actually going to start from slide 4 because I think that Fiona did a fantastic job covering the impact with regards to the climate crisis. And she had some amazing images or stunning or very, very worrying images as to the impact, just for example, in BC. I also just wanted to kind of highlight here that Fiona talked a lot about heat specifically, and this image kind of provides a really good overview of the impact that's happening around the world with regards to climate change's impact on human health. So, and when you think about this, you can think about the impact, for example, to respiratory disease, cardiovascular disease. You have worsened cardiovascular mortality when you have heat waves. You have changes in infectious disease prevalence and incidence as well. And that basically changes how we think about diseases like malaria. And then you also have mental health impacts and impacts that are related to the impact on food supply. So, for example, malnutrition. And Fiona did a great job as well talking about the impact with regards to vulnerable populations, particularly in urban environments, and where the heat waves can become even more concerning. And I just wanted to show here that this isn't just a future problem. As Fiona mentioned, this is a current problem. And already in Canada, more than 20,000 premature deaths are caused each year are attributable to air pollution. And we're going to see more and more mortality, unfortunately, related to everything from malaria to diarrhea to heat stress. I know I just wanted to quickly emphasize that, healthcare emissions, as Fiona mentioned, are quite significant. And the big takeaway that I generally mention to people is that the healthcare industry has more emissions attributable to it than the airline industry. So that just basically, it just completely shocks people and makes people really realize that healthcare emissions are quite significant. And of course, medications represent a quarter of this. This is a great image that basically shows where the impact of that medications is coming from. So for example, just the use of 1 meter dose inhaler, not the packaging, not the transport, not the manufacturing, just the use is responsible for. So the use of 1 inhaler is the equivalent of driving a car 300 kilometers. So desflurane, if you use it for 1 hour in 1 patient, it's the equivalent of driving a car 370 kilometers. And there are others that are out there that are much less in terms of, have much less of a carbon impact. So you can see sevoflurane having much less of a carbon impact than desflurane, for example, and there are alternatives. Within pharmacy specifically, so of course we could do, there's so much that we can do. There is a potential review with regards to anesthetic gases and inhalers. Dry powder inhalers, for example, have a lot less of a climate impact than meter dose inhalers. So we can think about this within primary care and tertiary care environments. We can look at anesthetic gases and look at what is on formulary, for example, within a hospital environment. I put buildings and materials and energy in gray because that is more relevant if you're constructing a new pharmacy. But sustainable procurement is also an excellent example of where pharmacy is also very, very involved as well. And the UK in particular has a great direction with regards to sustainable procurement. In fact, there's basically contracts that occur between manufacturers and healthcare systems. And in order for manufacturers to be competitive on the contracts, they actually have a 10% of the contract basically focused on meeting certain sustainability criteria. And that just basically got implemented this year. So pretty impressive. And the good thing about this is that we can potentially learn from this. With regards to mitigation as well, I mentioned that we can look at reviews of anesthetic gases. As Fiona mentioned, there's a lot of work that can be done with regards to deprescribing and really looking at deprescribing in the form of sustainable prescribing, where you look at that patient who has metastatic non-small cell lung cancer and you think, okay, do they really need that vitamin D or that vitamin C if they have a 6-month prognosis, for example, and attributing a sustainable lens here. And then also exploring alternatives to MDI inhalers where clinically appropriate as well. This is an example of work of an Ottawa Hospital Environmental Pharmacy Committee, and I won't go into this in much detail, but I just wanted to show that these are examples of what can happen on the ground. So we have a committee of 12 pharmacy professionals, half pharmacy technicians and half pharmacists. And we also have representation from management too, and they're divided into 5 different streams, and work is actively happening within each of the 5 different streams within education, operations, research, partnerships, and medication use. Within adaptation, there's a lot that can happen within pharmacy as well. So for example, an oncology pharmacist should understand the impact of climate change to lung cancer and to skin cancer and to dosing of renally toxic medications that are chemotherapy. A cardiovascular pharmacist should understand the relationship between heat waves and cardiovascular disease. An infectious disease pharmacist should be able to understand the changes in infectious disease prevalence. In addition, for both community pharmacy and for hospital pharmacy, it's important for institutions to come up with disaster plan recommendations to be able to adapt. If you think that we have increasing incidences of natural disasters and flooding, for example, we need to understand how best can we create disaster plans to be able to reduce impact on patient care. And of course, strengthening supply chains is very important. We saw the impact of supply chain disruption during COVID, but we're likely to see more and more of this as climate change's impacts become more and more significant. As Fiona mentioned, we need to think about medications and substances that can actually contribute to heat-related illnesses and think about how to dose these medications during a heat wave, for example. And information like this becomes more and more relevant when you're providing education to pharmacists about thinking about climate change specifically. So to help out, various institutions have kind of come up with guidelines. So this is a screenshot of what the ASCO posts. ASCO specifically for oncology has mentioned with regards to climate change's impact on oncology, but similar such publications exist for cardiovascular disease, for example, or for infectious diseases. So this is a great starting point with regards to thinking about specific specialized areas. For pharmacy specifically, I know my colleague Caitlin Roy has come up with a great article on the pharmacy impact of climate change, a call to action. And I can put a link to this article in the chat afterwards, but it provides a great overview as to what pharmacy professionals can specifically do. Electronic health records are typically a big victim of natural disasters. And we had an ISMP publication come out in August of 2022 basically reviewing the impact of patient care from unanticipated electronic medical record downtime. So unanticipated being the underlined word, and severe downtime lasting many, many hours or even days at a time can cause very significant effects to patient care. So most hospitals and even community pharmacies will say, oh, yes, we do have downtime procedures, but they're generally meant for planned downtime that is up to an hour. They're not necessarily meant for downtime that occurs over many, many hours or multiple days at a time. And we're not necessarily prepared for this. So there's a lot of work that can be done with regards to strengthening downtime procedures. So how does this happen? And how can we do all of this? Fiona provided a great overview with regards to various institutions that have been involved. I've basically split this into 4 different areas, including education and workforce training, policy and procedure development, advocacy and partnerships, including advocacy on a governmental level, as well as partnerships with organizations like Fiona put on her slide, as well as research. And we need to think of innovative ways to finance all of this work as well. I also wanted to mention that 15 colleagues across the country have come up with a climate pharmacy nonprofit. We started off with the Climate Pharmacy Network on QID that is related to CSHP and related to specifically QID. And now we are kind of developing a nonprofit. We've finished the mission, vision, values. We've finished the recruiting of all of our 13 co-leads, as well as the co-chairs and secretary. If you're interested in getting involved and being part of a team, maybe volunteering an hour a week, please contact me on my email address. And even if you want to kind of remain updated by this nonprofit, please also send me a quick email as well. To give you an idea of the momentum, all of this work that has happened with this particular nonprofit has happened over the last 6 months. So before that, we've had various committees across the country and various smaller institutions, various hospitals create their own committees and work kind of in silos. And now we're trying to create a nonprofit that really looks at how do you capture the best practices and basically make those best practices available for pharmacists and pharmacy technicians across the country. Thank you. And I hope you have a great afternoon.
Thank you so much, Shaliza. That's incredible momentum to just hear of all that's been accomplished over those past 6 months. And also just wonderful to hear about, some of the emerging collaborations, even just in the initial remarks from yourself and Fiona. So thank you so much. I'd like to pass it over now to Celia, who's going to build off of a lot of what Shaliza just said. Celia, I'll pass it to you.
Great. Thank you so much. Can you see my slides?
Yes, thank you.
Great. Okay, thank you so much. Good afternoon, everyone. And I'm just honored to be part of this event and be invited to present alongside this group of speakers. So I'll be focusing on kind of building off of what Fiona already spoke about, as well as Shaliza, related to medication management in a changing climate. So just wanted to briefly acknowledge that I am speaking to you from the land of the Coast Salish peoples and the Esquimalt and Songhees nations of the Lekwungen speaking peoples. And I want to thank them for keeping their territory alive. And I echo Annalise's words that she spoke at the beginning, that First Nations peoples have been stewards of our lands and oceans. And I really look to them and their example for how we can honor and respect our planet, which is so critical for our health, and we depend on it. Today, I'm just going to hopefully focus on a few areas of medication management related to climate change. I have other kind of work I'm doing in this realm, but for the context of this brief presentation, hope to provide you with some practical tips that you can adopt into your practice right away. So climate change, we've already seen some pretty dramatic images. Here's another one. This was one of the main arteries, a major highway in BC that was devastated by the atmospheric river in just over 1 year ago. And this highway is integral to the movement of goods and people. And supply chains are already tenuous with drug shortages. And so further wiping out infrastructure had profound impacts on the ability of both medications to move between areas, as well as patients to be able to attend pharmacies and medication or healthcare facilities. And so we hear about regulatory bodies and even ourselves probably advising our patients, keep some medications on hand in case of emergency, which is important to do. But when you think about the reality of it, patients having a grab and go bag with a 2-week supply of medications. Well, if there's a patient on blister packs, or they're being up titrated or deprescribed, the reality is it's actually quite difficult for patients to have 2 weeks on hand. So how can we be practical when we talk to patients about being prepared for emergencies, and maybe focusing on patients that are consistently refilling their prescriptions on the last day of their supply, urging patients to be a bit more proactive, because patients really should try to have medications on hand, but try to be in the context of reality, how difficult that can be. Maybe focusing on patients, for instance, post acute coronary syndrome with profound impacts of being on their compliant with their antiplatelet therapy, maybe targeting certain medications, really thinking about how we can support patients to be as prepared as possible should one of these extreme weather events occur. During heat extremes, we've already touched on this and some of the health impacts, but we know that heat stroke can be severe, life-threatening, can lead to increase in hospitalizations. And in BC last summer, 2021, over 600 people died related to extreme heat. And I was here in BC and experienced this extreme heat myself, and was devastated to hear about the impact that it had on our citizens of British Columbia and our healthcare system. So we know that body temperature is regulated by balancing heat production and that heat loss. So we're balancing here. And we know that heat loss is determined by how quickly we can get heat from the core to the skin surface, and then how rapidly the heat can transfer from the skin to our surrounding areas. Unfortunately, medications can impair different aspects of heat regulation. So medications can increase heat production, increase your metabolic rate, and also impair the ability for heat to dissipate from our body. Going back to pharmacy school, I think we can all remember the anticholinergic toxidrome, and I just wanted to highlight that hot as a hair component of an anticholinergic toxidrome. So very brief review of some pharmacology here. Anticholinergic medications bind to our muscarinic receptors. There's the M1, the M2, and the M3. So focusing in on the M3 receptors, sweat glands are innervated by these M3 receptors. So when you have anticholinergic medications on board and you're impairing the sweat glands to actually dissipate that heat, patients can be at higher risk of hyperthermia because they're literally unable to get that heat out of their skin. And so that hot as a hair, dry as a bone, patients have a difficult sweating, and which is a critical mechanism to dissipate heat, especially in extreme weather events. It's not just anticholinergic medications, and I'm not going to list them all, but I think many of us here know there are many medications with anticholinergic properties. I wanted to briefly touch on some other medications that can be relevant in extreme weather events. So we know people with pre-existing mental health conditions are particularly vulnerable to climate change. Of the over 600 people who died in BC during heat dome, a disproportionate percentage of those patients had mood and anxiety disorders, including depression and schizophrenia. Now, those conditions themselves, the neurotransmitters involved, are also related in thermoregulation. So it could be a component of the disease state itself, but there's also these medications that can impair thermoregulation. So patients with psychiatric conditions on psychiatric medications, that is associated with a higher risk of injury and death during heat extremes. There are other medications too, again, in the context of this presentation, very brief overview, but diuretics, SGLT2 inhibitors, RAS inhibitors, NSAIDs, these can all, extreme heat can increase the risk of adverse events associated with these medications. There are some medications such as inhalers where there's actually increased potential benefit during a wildfire. So kind of considering risks and benefits and supporting our patients to get through these extreme weather events and really giving this some thought ahead of time so that we as healthcare providers can be ready to support our patients. And then this also ties in with storage and stability, particularly with medications in liquid or different topical forms, how they can be very sensitive to extreme heat or freezing temperatures. Pharmacokinetics are also affected related to extreme heat. So as body temperature rises above normal, we get vasodilation within the skin. And so that increase in blood flow helps heat loss, heat to get to the skin surface so that we have improved heat loss. However, once we have increased blood flow, that's actually going to allow more rapid absorption and or higher plasma drug concentration levels for medications administered transdermally or subcutaneously. And there have been studies showing clinically significant effects. For instance, hypotension related to nitroglycerin patches, increase in headaches as well with nitroglycerin, hypoglycemia, particularly with rapid acting insulin products. So this is directly relevant to our patients and how we as pharmacists should be aware of these so we can support patients. So what can you do? Like I mentioned, I was hoping to leave you with a few tangible pearls. So one thing you can do is talk with your pharmacy team. Are you prepared for an extreme weather event? Shaliza mentioning about downtime in terms of electronic medical records and health records. What is your plan for supporting patients on daily witness ingestion of opioid agonist therapy? There are provincial policies, that outline expectations for what pharmacies need to be ready to do to support patients during states of emergency. So being familiar with those, talking with your team, coming up with a plan so that you're ready. And also, as mentioned, supporting patients' preparedness as much as possible. What's realistic? Who's potentially the most at risk? And then just kind of following along with that, identifying and educating patients who may be the most vulnerable during extreme weather events, particularly providing medication-specific instructions, patient-specific instructions, because one recommendation for furosemide during an extreme heat event may not be applicable to another patient. So thinking about medication, thinking about the patient, and tailoring your education in those individual cases. So these are my two girls who are my inspiration for lots of work outside of work hours. And I really, again, appreciate you inviting me to speak, and I'm looking forward to the other panel and the Q&A.
Thanks so much, Celia, and nice to see that you're starting your girls young with saving the planet for the future. Thank you so much for your remarks. I think those are some really wonderful practical considerations at the individual level that really complement Fiona and Shaliza's comments, with a lot of the policy and system considerations. So thank you so much. Next, I would like to pass it over to Terry from HPSA, who's going to walk us through some of the work that her organization is doing.
Thank you, Annalise, and thank you for the invite. It's been a real pleasure listening to the panelists ahead of me and all the great work that's being done. And I think the way this is built out from a good overview of what's currently happening, and I'm going to talk about what's currently happening with our association, but also what could be happening as well, and some of the best practices that we are considering. So again, I'm Terry Drover. I'm the Director General of HPSA, which is the Health Product Stewardship Association. We're a nonprofit that looks after the regulatory obligations of pharmaceutical manufacturers of prescription, over-the-counter, natural health products, and medical sharps. We ensure they meet their regulatory obligations in the 4 current provinces in Canada where there are EPR or take-back regulations. So this is a little bit of the data just to give sort of level set your understanding of what we do. We've been around for 20 years. And I'm apologizing for that noise in the background. I told Annalise, I have some contractors here putting windows in, so we're trying to maneuver around that. We have 146 members currently. I think it's almost at 50. We're in 4 different provinces right now: BC, Manitoba, Ontario, and PEI. But the exciting part is Quebec, New Brunswick, Saskatchewan are also about to regulate. It's exciting and also a little scary for us as a small organization of 7 or 8 people. For example, we currently rely on a little over 6,000 community pharmacies in Canada in those 4 provinces. And without community pharmacy, we wouldn't have a program because they act as our interface with the consumer and our collection depots per se. When we expand to increase 3 additional provinces, we'll have almost 10,000 community pharmacies participating in this program. And again, we couldn't do it without community pharmacies. So I'll just move on to the next slide. So since our inception, we've collected, almost 4.5 million kilograms of pharmaceutical products. And those have been diverted from landfills or our waterways. And almost 3 million kilograms of medical sharps have been taken out of landfills since our inception. So this slide just is a breakdown of the 4 provinces we're currently in with the amount of kilograms collected. And again, this is all due to community pharmacy participation. So I want to emphasize that. I'll move on to the next slide. So you're all aware, as I'm probably the only non-pharmacist on this panel, about the aging demographics in Canada and the utilization of medications. And already half of Canadian adults are on at least 1 medication. As you get older, obviously, those numbers go up substantially. We've also had a couple of other things that have been driving utilization. We've had the introduction of many more affordable generics into the market. And with that comes people switching between generics, and that also contributes to some of our challenges as far as leftover or unwanted or unused medications. So I'll move on to the next slide very quickly. So how we reduce the impact on the environment and health. Obviously, we divert medications and sharps from landfills, but we're also teaching consumers how to properly dispose of their medication. So how do you get rid of them? Don't throw them out in cat litter or coffee grinds in your garbage, please. Don't flush them down the toilet. And even if you think it's just a vitamin, how harmful can that be to the environment? It can be. All of the fillers used in some of these medications have been found in water testing in our freshwater systems in the Great Lakes, for example. Also, it's important to remind consumers that the water treatment facilities in municipalities do not filter for pharmaceuticals and certain chemicals. They make sure there's no E. coli. They maybe fluorinate the water, but there are no filters per se to remove any kind of pharmaceutical waste from water treatment facilities. So we rely on pharmacies to educate consumers about this. We also rely on pharmacies to, as I said, collect that medication as well as collect the medical sharps. We do provide quite a bit of education, not just for consumers, but also for pharmacies. So we provide as much resources to pharmacies to help them in their intent to educate their patients. And we've also engaged with an advisory group made up mostly of community pharmacies to ask how best we can meet their needs in a community pharmacy environment. I'm well aware how little time we have when you're in a busy dispensary to remind patients about bringing back certain medications, but particularly opioids, antibiotics for sure. There are certain even categories of medication that are very important just to remind consumers when they're dispensed. The next slide. So where does Canada stand in relation to the world? So we are a global leader in take-back programs for medications and medical sharps. We have the second largest medical sharps collection program in the world, behind France. And we're always looking for best practices. So for example, we are working with Gastry, which is the French counterpart of ours, to look at how they're managing take-back programs. One of the things they're doing that I thought was very unique is they not only have their sharps containers in pharmacies, but they also now have a purple sharps container, and that's meant for medical devices only. because they're partnering with a recycling agency within France on a pilot project to see how much of that medical device can be made into recyclates. Can they be taken apart? Can the plastics be reused? So that's really interesting. The Danish company Novo Nordisk, which operates in Canada as well, big diabetes presence. They've launched in Denmark a take-back program for their insulin pens. And then in Sweden and Portugal and the Netherlands, they have some of the highest take-back programs in the world. And we're looking at how do they engage with their consumers so effectively? And maybe there are things that we could use as best practice here in Canada. But we're also looking in Canada. We have worked, Fiona mentioned it, with Cascade recently. And one of the things that we're really interested in is sustainable prescribing. Because we can't control or regulate how much we take back. We have to take back everything that's generated. The only thing we can influence is maybe helping upstream. So maybe we can get to physicians and talk to them a little bit about how best to sustainably prescribe. Now, specifically, since pharmacists are taking on more of a prescribing factor. Okay, the next slide. Again, I'm so sorry. So we're very excited to be partnering with pharmacists, but we're always looking for new and creative ways of impacting the environment through various take-back programs. And there was a slide earlier about how forward-thinking BC and Quebec are in this space. I want to say one thing, but we're about to launch in Quebec. We are regulated under the Ministry of Environment, and it's a healthcare program. So it can get pretty difficult sometimes to enact some regulations written by environmentalists who have less knowledge about healthcare. So we're really working to try to coordinate the ministries of health with the ministries of environment so they can both collaborate on some of these programs, specifically because take back for pharmaceuticals and sharps is much more, is very unique. It's not like tires and paint. There can be no collection targets, right? I mean, they're meant to be consumed. So I'll turn my mic on mute. And again, apologies for the background noise. There was very little I could do at the last minute. So thank you very much for the opportunity, and I look forward to the remainder of the presentation.
Thank you so much, Terry. And thank you. I think all of us, are hanging on to your words, and your slides were very valuable in providing a lot of fantastic information about the work that HPSA is doing. I think one of the things that really struck me is just the sheer number in kilograms of the work that your organization is doing. And I think the prospect of just being able to expand into other jurisdictions and have this repository probably of lessons learned from each of those areas is something that I think, everyone on the call today would be really interested in learning more about in the future. So thank you so much. So we're almost at 2 p.m., but I would like to pass it now to our final panelist for today's formal panel remarks, Tarek, and then we'll start to segue into audience question and answer after Tarek's remarks. So would just like to encourage everyone on the call, if there are questions or comments that are starting to come to mind for all of our panelists, some of our panelists, please feel free to type those into the chat and we'll get to them after Tarek's remarks. Thank you.
Well, thank you, Annalise. Can you see my slides?
Yes, you're all good to go.
Okay, so I'm really excited to be sharing the stage with the experts in this field. And I've been listening to those wonderful presentations and keep thinking from business perspective about why. Why should a business, a pharmacy, adopt an environmental sustainability kind of practice? And the answer to me is simple, because basically, as pharmacists, we have values and we are ethical. We act with integrity and with honesty. We care about our patients and our healthcare system, and we are competent. So to me, that's the call for adopting environmental sustainability. So when we are told that the climate crisis is a health crisis, we should listen and we should care. So I think this is a call for every community pharmacy as a business to kind of engage. But what can I do? Do I have an impact? Can I have a difference? Yes, you can. You just need to believe and start. And today I'm going to share with you 3 tips. I call them the 3 E's that I want everybody to, hopefully it can be helpful for everybody to start slowly and make sure that this works. And you'll be surprised that they might cost very little or even not at all. The first tip is to get out of your comfort zone, which is your dispensary. So the minute I got out of my comfort zone, I live in the beautiful city of Kingston, Ontario, and I got out of my comfort zone. I started joining the Chamber of Commerce in Kingston, and I ended up being their chairman of the board last year. And working with the chamber for the past 6-7 years, I got to know so many businesses in the city. You probably know Queen's University and so many others, the big ones. There was something common about those guys, that they are all a member of Sustainable Kingston, which is a regional environmental nonprofit that is created by the City of Kingston and Trillium Foundation in Ontario. And if a brewery can do it, which is McKinnon Brother, if you like beer, I think a pharmacy can do. So we joined. We ended up getting 5. These people love badges. They love to give you badges to show you how you're doing. We ended up getting 5 badges, and we are the 2nd largest number of badges in the whole organization after Queen's University. I'm going to share with you 3 today: the climate action, the carbon footprint, and the recycling. And we are very proud because in the last 5 years, we've been able to reduce our greenhouse gas emissions by 50% since the start. And in 2020, we've been awarded the greatest reduction in greenhouse gas emissions in the city of Kingston as a business, which is a great achievement. So the tip here for you is to explore. Number 1, get out and explore, the first E. This takes me to my second point, that small steps makes a big difference. So you don't need to do so many things, but you need to start looking at what you have already in your place, what you already are doing. So Terry talked, and thanks Terry for the excellent presentation about collecting the unwanted sharps and medications. Are you doing that? Are you creating your own waste by compounding or by dispensing methadone, for example? So are you kind of like sending or taking care of that hazardous waste properly? If you're doing that, so you are already doing something. Are you recycling conscious? My team in the pharmacy knows that I keep running after them, looking at the recycling pens. Is it a plastic or is it paper and all that stuff? So are you conscious about that? If you're doing recycling properly, you are doing something. What kind of paper bags are you using? Did you stop using plastic? What kind of vials? So many companies right now that are providers, we're working with an eco-certified provider for kind of vials, for example. So we make sure that the vials are more compatible with the environment rather than just any other plastic that we use. The same goes, and we are expecting to see in the future some kind of biodegradable kind of containers where we can put medications on. It's coming already. What kind of, are you doing blister packaging? What kind of material are you using? Is it also eco-compatible? Do you have so many blister packs to the degree that you may want to think of outsourcing that, so you reduce the footprint in your pharmacy when it comes to services like that in the future? So my comes to technology, which is a big thing. Who is still using this thing? My God. So I hope that people can start thinking about going digitally. I think digital health is the future for pharmacy. And maybe you should adopt an e-fax system or even an e-prescription. It is available right now. Maybe paperless workflow through the software, pharmacy management software you're using, we also use kind of an e-commerce platform to expand our over-the-counter portion of the pharmacy in a small pharmacy, 800 square feet. Digitally, we are using a cloud-based point of sale, some kind of appointment-based, kind of cloud-based appointment booking systems. I'm looking for the day when we see a cloud computing system that is not depending on kind of like paper or servers that are taking so much of the environment, as we know. So the second E for you, or the conclusion of that, is to assess what you have and start to take small steps. And it would, you'd be surprised, you're already probably doing so many of that. And to take a step moving to e-fax or maybe e-prescription, or even some sort of a digital platform for your kind of like over-the-counter products, it might not cost you much, or even sometimes it will cost you exactly what you are already doing to do the same service in a way or another. And my final point is be a champion, or be the champion of this. Champion what we talked about today. I heard a lot of good kind of ways as from the clinical and from the environmental point of view from all my colleagues in the panel. Look into all the different kind of ways to reduce the carbon footprint. And I would summarize it in optimal care, basically, optimal care. Whether it's the right prescription, the de-prescribing, using the right inhaler, all the stuff we heard from all my colleagues, it is an optimal care. So it is the point of engaging by educating your team, being a role model for them, sharing your experiences with other businesses in your area, and motivating others in your community to be able to kind of like lead and champion this. So to summarize, I would say it's time to start, because we care. We are pharmacists and we care. And thank you so much.
Thank you so much, Tarek. Wonderful, again, very, very practical considerations. And I particularly very much appreciate the strong community engagement and lens that you bring to, obviously, to your work at your pharmacy, and also more broadly to the city of Kingston. I think that that's so crucially important, especially as we move forward in this area. So I would just like to, at this point, thank our panelists for such phenomenal remarks. I learned something new from each of you, which always amazes me as I get to learn and host these events and learn from our panelists. I'd like to open it up at this point to the audience for any of their questions, comments, remarks. As I mentioned, for one of our panelists, all of our panelists, and start to get to that. I can see one comment now from Suzanne in the audience. Hello, Suzanne. I'm just going to read it out loud, and then I'll know if it's a question or a comment. Canadian pharmacy practice is dominated by a handful of corporate oligopolies. Are these major pharmacy chains actively looking at greener strategies in the dispensing process? Specifically, when can we eulogize traditional practice vials? Time to consider a regulatory lever to mandate greener vials for dispensing. Oh, thanks, Suzanne. Dispensing plastic vials, they're in a landfill. Do any of our panelists want to tackle responding to this question? Terry, yeah.
Yeah, we have on our board, as well as many of our members, obviously, are participants in larger retail chains. And I can speak clearly about their intent. They have reached out to us on a number of occasions to look for opportunities to partner with us on how they can become more sustainable within pharmacy. Vials, plastic, how best packaging is another big concern of these major chains, and the packaging specific to pharmacies. So they're keen on this. There's a number of initiatives, even pharmaceutical companies, and that's my background. I grew up in pharma. They've moved to a much more sustainable mindset in mission, vision, and values, and they're really starting to walk the walk and not just talk the talk. But certainly, we are engaged with our retail chains to look at opportunities to move forward on sustainable initiatives.
Thanks, Terry. Tarek, do you have any remarks on that as well, just from kind of some of the things you mentioned in your presentation?
Well, yeah, thank you, Linda, and thanks, Terry, for your comment. I think most of the companies, the providers right now, I'm looking, like Terry talked about the big chains, and we are in a small independent pharmacy. So I think it's a responsibility for everybody to look at the options available and to start kind of being mindful. So we look at the suppliers of different kind of vials, for example, and I, as I said in my presentation briefly, I actually got them to send me some documentation to prove that and studies that they've done in-house to show that the vials, for example, are more eco-friendly, and that the type of plastics they use is less, and it can be recyclable, and all that, and all these aspects. So I think if we start to be mindful about it and start to ask, you'll get the answer. And the surprising thing that the supplier I'm talking about is actually offering these vials in a cheaper cost than the regular plastic. So sometimes, as I said in my presentation, you might not spend more. You might even out or even spend less. You just need to ask.
Thank you. Thank you for those remarks. Does anyone else from our panel want to weigh in on that question?
This is related, but not, it's related, but a bit different. I was just thinking, reflecting on this, I don't work in community practice, so I can't speak specifically to this, but I do wonder, as like a clinical pharmacy coordinator here at Island Health, is talking with the pharmacists about deprescribing. And I believe that from a kind of regulatory level, supporting community pharmacists with deprescribing type practices. So it's not related to the packaging per se, but just also how can we remunerate community pharmacists for actually deprescribing? Because we know that any medication that is deprescribed, you know, it doesn't need to, well, there's manufacturing impacts, transportation impacts, packaging impacts. And so it's not really incentivized right now from a community pharmacy point of view to deprescribe, because that's the dispensing fee that pharmacists are getting. But how can we support that practice of deprescribing, but still acknowledge that community pharmacy has this business aspect to it? So finding that balance of what's best for the patient, what's also sustainable from a business point of view. And so I think there's a lot from a regulatory point of view. And so we as healthcare providers connecting with our elected officials and providing ideas about how they can support us to have a more sustainable practice within pharmacy, whether that's packaging or the clinical piece.
Yeah, thanks, Celia. I think those are really important considerations that, you know, rather than viewing environmental sustainability in this box and deprescribing in this box as, you know, different components of pharmacy practice. I think I really like how your answer just kind of touches on that need for integration across all of those areas. I can see quite a few questions kind of pouring in from the chat. So maybe I'll direct Linda's question to Tarek as well. You mentioned that you're using eco-friendly practices to reduce your footprint. How expensive is that for your pharmacy? And how would you encourage other pharmacists to follow your lead beyond the 3 E's?
Well, as I said in my presentation, I think it is not as expensive as you think. It might be even more or less equal. Like, for example, pharmacy management software, if you ask for an eFax kind of module, it might be a little bit like $10, $20 more or something. And it might even out with most of what you're paying. Because if you're paying between $300 to $500, which is a month, which is the average kind of cost of a pharmacy management software, I think if you pay like $10 to $20 more and get an eFax module instead of just using all this paper with a kind of a standalone fax, it's a tiny investment, but it has a bigger kind of impact. I see like a whole kind of shift toward digital health, digital therapies. Like we're talking about, and I'm happy to hear Fiona touching on the social prescribing, because I'm a big social prescribing fan, and I'm actually a founding member of the International Society for, or International Social Prescribing Pharmacists Association out of the UK, not surprisingly, and talking about digital therapies, for example. And I'll give you an example of the cognitive behavioral therapy. And when you talk about the first line of treatment for insomnia is cognitive behavioral therapy, and there are internet-based ones, and these are considered digital therapies. So these are options that we can start working on. But how can we help pharmacists to include or have all these kind of data or all these kind of algorithms embedded in their kind of counseling or consultations that they do every day for their patients? I'm hoping to see this coming in the future and coming in digital platforms that pharmacists will be using in prescribing for minor illness, for example, in Ontario. And the final point about that is the impact of environment. Right now, most pharmacies are using a server-based, it's a real server, it's a real desktop. And if you switch to a cloud computing, my understanding, and I hope that if anybody have a different view, let me know. It'd be good to correct my understanding, is that it is less impactful on the environment, running all these servers versus the cloud computing. I know it's still another kind of a server-based system, but you think about the impact on the business itself, like a pharmacy or a hospital, versus using a kind of a mobile kind of virtual care based on a cloud computing. So I like to debate on that and hear more from the panelists or even the audience.
Thank you so much. I think you touched on sort of Fiona's question to you as well in the chat about the preference for digital over paperless. Do any of our other panelists have any remarks or any debates to take up on that? Shalita?
Well, I'll jump in.
Oh, yeah.
If I can, to elaborate my point, which is that information and communications technologies are actually sort of lots of environmental hotspots in terms of resource extraction and non-trivial in terms of waste disposal. And then the cloud, in terms of energy needs, is quite significant. And it very much depends on what grid is being used to support those energy needs. And it's oftentimes virtually impossible to know whether this is coal-fired energy or hydroelectric energy when you're procuring your cloud services. And health data generally is the biggest chunk of data that is growing. Big data investigations are incredibly energy intensive. So I think, as with many environmental, by no means all, sometimes there's it's absolutely for sure appropriateness in care, reducing unnecessary care is an environmental winner as well as a health winner. But for some of these things, there's an it depends. And I'm kind of curious because in work that with colleagues trying to review the literature and recommendations from pharmacy, there seems to be this really quite strong interest in digital over paper. And I'm not quite sure where that's coming from, because paper, of course, can be quite a renewable resource. So yeah, very, very curious about that.
Yeah, thanks, Fiona. I think those are really important considerations. Shalisa, do you want to weigh in on that too?
Yeah, I would just add that I kind of agree that it's kind of it depends kind of question. I think going ahead, it looks like we are kind of going in the direction of the digital landscape. So I would kind of propose two things. First, when we're thinking about the move to digital, are we thinking about bringing in new products, new digital products? Or are we thinking about using those existing digital products? So for example, you have computers anyways because you and the equipment anyways because you are processing prescriptions, for example. So then bringing in an electronic health fax is at least doesn't add in extra equipment. The second question is that it looks more and more, we tend to be in our own silos as pharmacy professionals, and it looks critical now that we actually look into the type of energy that is being used to power the very buildings that we work in. And there is kind of a movement. I know my own partner actually works in the renewable energy landscape, and there is more and more work that's being done in that realm. But from an advocacy perspective, knowing that this is a part of health systems, and it has an impact on health. So although engineering seems very different from pharmacy, it's something that we should kind of have some kind of stakeholder input within.
Thanks, Shaliza. I'd like to direct maybe just the next audience question to Terry. Could you elaborate on how HPSA is reaching out to consumers to actually deliver the message of proper storage and disposal? Particularly, I think just in the context of, working at this time, I think you said with 6,000 community pharmacies or pharmacists and expanding to 10,000.
That's a great question. We have really ramped up our communication efforts in the last year and a half. We partner with other agencies like Drug Free Kids Canada to do radio campaigns and media campaigns. We've really tried to leverage social media as best we can as well. We're looking at white papers that can be developed for publication. We work with municipalities where it's appropriate. Many of you, although they're either digital or printed, but the waste schedules by municipality, we try to coordinate our messaging sometimes with some of those schedules. We also provide assets to the pharmacy that can be distributed either in bag stuffers, poster, or what have you, to consumers. And what we've noticed, and I was going to bring it up a little earlier about the sustainable practices in pharmacy and who's driving it, consumers are getting engaged, right? They will ask, what are you doing with my little vial? Is that just going in a landfill? Like, we're finding more and more consumer engagement, and we're pretty obscure, but they will reach out to us and say, so what really happens to the medications when I bring them back to the pharmacy? So I think that curiosity is a good thing. And we're seeing more and more consumer engagement with efforts that we've specifically focused on. And we will look for other opportunities to engage with consumers specifically to educate them. But our collection rates have steadily gone up dramatically in the last 2 years. Maybe COVID related, because people sort of hung on to a lot of things during the worst of the pandemic. And then we saw a bolus of product come through the system. It's also a lot of expired over-the-counter stuff, because as soon as the pandemic hit, people ran to pharmacies and bought Tylenol, ibuprofen, you name it, anything they thought they might need, and stocked up. So we're starting to see the expiry dates on that come through as well. But all of that to say that I think our messaging to consumers is getting more targeted and more effective, because we are seeing that consistent growth of collection volumes through pharmacies.
Oops. Thanks, Terry. That's great. And I think I really appreciated your comment as well, sort of about the reciprocity. Like, this just can't be coming from consumers. It just can't be coming from pharmacies or pharmacists. And yeah, just kind of the bi-directional flow with a lot of the stakeholders that we've spoken about today. I know we have a few minutes left in our event today, and I guess I just wanted to throw maybe a final question out. I'd love for everyone to weigh in on our panel. And that's around the theme of education. I think that education was something each of you sort of highlighted in your presentations and remarks in different ways. And I think my question is specifically around, where do you see this landscape going in terms of how we educate emerging pharmacy professionals? We touched on everything today from sort of an individual level of, as a pharmacist, I can do this to this medication and help a patient. Celia, some of your remarks. Tarek, your perspectives are very on the ground in your pharmacy. Terry, the work that you're doing nationally. Shaliza, the work that you've done, within the hospital and sort of that committee that you've formed to form these networks and sort of outreach areas. And Fiona, I think the overview you gave, globally what's going on. So what does the future look like for emerging pharmacy professionals in this space? Shaliza, do you want to start us off?
Yeah, so I'm about to make some strong statements. So so I thought I would just kind of start off in that way. Look, I think the time is in the past for pharmacy schools to not talk about climate within pharmacy education. I think it impacts so many aspects of pharmacy education. If you think of infectious disease, if you think of your cardiovascular courses, if you think of oncology, if you think of community pharmacy, if you think of hospital pharmacy, I think it intersects with so many different areas. And if we take an insular approach to education, what is going to happen is that every year we're going to have, for each university, we're going to have 200 emerging pharmacists who have no idea that climate change is impacting the practice. And on the flip side, if everyone knew, then all of these organizations that are sprouting around everywhere, including our own nonprofit, would suddenly be boosted and suddenly kind of scale up very dramatically if you think over a period of a few years. I think the answer is in accreditation. So I think that for pharmacy schools to be able to go through the accreditation process, there probably needs to be accreditation standards focused on incorporating climate competencies. And I think if you do that across the country, then you can have a massive impact. Unfortunately, our time scale is kind of small. So we also need to think about the existing pharmacy base that we have at the moment, and somehow involving institutional approaches within hospitals, within Ontario Colleges of Pharmacists, for example. Maybe they have to do a climate module, for example, in order to renew their licensing. I think this is critical. And it's only with that you will have the increase in advocacy. You will have more and more financing as well for climate pharmacy positions as well. And you'll have a greater support with regards to these organizations that currently exist.
Thank you so much, Shaliza. Fantastic points. Celia, I can see your hands up.
I agree with Shaliza's points. And just to add to that, trying to think of it like from a very specific to an individual pharmacy student, I think there could be opportunity to embed planetary health impacts of drug therapy recommendations into that pharmaceutical care plan process. So at UBC, I support a number of UBC students, even though I didn't do my undergrad there, but they have the NESA approach. So necessary, effective, safe, adherence. So how do we include in that thought process, what is the planetary health impact of this recommendation? So, are we going to make this dose adjustment? Are we going to add this drug therapy? Are we going to deprescribe? Putting in planetary health impacts into that pharmaceutical care plan thought process so that it is front and center, a stepwise approach, big on that systematic approach, and include that right in there with, patient workups so that it becomes part of the culture of clinical pharmacy practice. But there's so many things, but that's just one idea.
Yep. No, thanks, Celia. Tarek, you.
Well, thank you, Shaliza and Kelly, for the amazing, and I agree with you both 100%. I think I come from a different perspective all the time, coming from I would like to see other clinicians educated as well about climate and the impact, and about what pharmacies are doing, pharmacists and pharmacies in the industry, in the hospital, and in the community to mitigate climate crisis. They need to understand what we're doing. They need to work with us. Because I see different clinicians, I work with them on a daily basis, and I don't think they really even, I don't know. I don't want to make a big statement, but I don't see if they are doing the right job like what we do in a way or another. And the other thing as well, adding to Celia's point, is the when we teach pharmacotherapy, if there is a part in every single module about pharmacotherapy, different kind of diseases, of the impact of medication, as she said clearly and 100%. But early on, like grade 1 or year 1 in pharmacy school, early on, which ones we should kind of aim for, which ones we would leave or reserve for the least kind of like resort in order to, unless the patient really needs that particular medication.
Yeah, thank you so much. I think those interdisciplinary collaborations and connections are really, really important. I know we are at 2:30, so I want to be respectful of everyone's time, but Fiona or Terry, do either of you have a final comment on that question that you'd like to throw out there?
Two things. I would say that other disciplines are moving. CanMeds 2025 is going to include this for physicians. But the other thing is that we need to think about continuing professional development. It's not enough to do this for the newly coming up. We need to actually sort of work on the existing practitioners. But thank you very much for this opportunity.
Yeah, thanks. Terry.
Just one final thought, just getting, if we go far enough back down through this process, having Health Canada, as they approve drugs for sale in Canada, using an environmental lens to evaluate what drugs they're going to allow on the market might also be effective. Or putting a rating on new drugs. This has a rating of this. You may not necessarily want to prevent it from being on the market, but you can at least say it has a rating of this on the environmental impact scale, so that when all of the other healthcare practitioners out there start to get educated and think sustainability as a mindset, they will take that into consideration. Similarly to a toxicity of a drug, how toxic is it to the environment?
Thank you. I know we are 1 minute over, so we'll wrap up there. But on behalf of the Center for Practice Excellence, the Leslie Dann Faculty of Pharmacy at the University of Toronto, I would just like to extend such heartfelt gratitude to each of you for your remarks. Audience, thank you for your questions. And I'd just like to wish everyone a very happy holiday and look forward to connecting in 2023.